No. Ke nna Rebecca Digamela ke Chairperson ya Health Portfolio Committee. Re tsamaya le maloko a Portfolio Committee ya rena ya Health. Ka mo right ya ka ke na le Honorable Matsidiso Mfikwe le ena ke leloko la committee. Ke tla le introducetsa o mong ga tla o tlo dula mo, and then le o mong ba babedi ba bona bile ba fihlile ke ba bone, and then ba bang a ka ba bona, so a go tshwenye le ge re ka se bolele gore ke bomang. And then le committee coordinators ba bantši ba lena le ba tseba because re tsamaya le bona every day a kere ke Nokwazinkidi re tsamaya le ena ka mehla, ke Nondumiso August ke committee coordinator, senior committee coordinator and committee coordinator, and then ke Dr. Ninweli ke researcher ya committee ya rena kere, and then re na le Department of Health for now e eteletse pele ke DDG Basani Baloi. Kopela we emise letsogo. Yeah. So re tla re he re ya ko di apology, then re tla tlhalosa hore ke bo mang ba ba le mo meeting. Mara ke a le amogela mo meeting bile ke le leboga gore every time re na le meeting le a tla ba bantši ba lena so that le tlo mamela gore re bolela ka eng. So before bile ke subella ko gole ka di rules tsa go legislature, pleke e re declare hore ke precinct ya legislature. Go thoma no ge meeting o thoma go fihlela ge meeting o fela, pleke e re leng mo go yona e emetse legislature ya provincial government ya Gauteng a kere. So dilo kaofela he re di dira mo re tla be re le batho ba ko legislature. So le tshwere program rule e re berekang ka yona gore pleke e ke ya legislature ke rule 57, sorry rule 56, because a re ko legislature e dulang ko Gauteng. So ke a leboga rule 56 ya re dumelela. Now item 3 ke di apologies. Ke received apology from Honorable Duplessis a go mo meeting ka baka la mabaka a rileng ke ena rometseng apology. Ya bobedi ke Honorable MEC wa Health o etla mara o tshwaregile somewhere. A kere today ke Nurses Day ne, so we ile ko Nurses Day, then ha tloga kwa o tlo re joina, mara like ke boletse gore me pasani o mo, so MEC ga re joina me pasani tlebe a le mo o tlo introduce ba tsamaya le bona leadership ya Department of Health gore le bone gore Department of Health e tlile le bomang. Mo gaufi le nna mo ke Honorable Litsie, so le ena o hona mo Honorable Litsie Mogale, le ena ke committee member, and then ke na le Ntate Mpapa Kanyane le ena ke honorable member emisa letsogo ke member Litsie, and then ke member Kanyane. A re phaphatheleng rena ba botlhe le committee matsogo. Ke a leboga. Ke tlo khupela hore me Pasani Baloi mo legatong la Department of Health in Gauteng a bolele hore o tlile le bomang yena re sa emetse MEC mara ke re boseka boija.
Abshim Dumelang Sanbonani Locha Macheron. Naki Basani Baloi, I'm the Deputy Director General responsible for corporate services. So on my left, Kitamaili Medoda, Oaling responsible for finance, today, go meeting or chair Otlaba actor as a CFO. And then Renali Mem Mope, I can't see here. Mem Mope Kibale Kibonaba acting as a Chief Operations Officer. Kinali Ntate Kobo Bonaba actor as a head ya infrastructure. Chair Kibona ba kibaboning so far, hona li baba ngwe. And then to apologize, Chair, li HOD unali MEC ko Pulusong, that's why I'm leading the delegation. And go officing ya MEC rinali Chief of Staff unaduzi mo waroko yelo litla mona hapa ha khutla. Ki me Gaugelo Malisa. Thank you.
Re a leboga ene mme Mope wa tseba gore a tshwanela go dula ko re leader from the front a re lead from the back, so the officials be ba le hona ka mo pele mo hantši re ba beela ditulo gore ge ba tlo araba di questions tse le di botsisang re ska monyaka somewhere re sa mmone akere. So to item number 4, re tlile mo gore Department of Health tle re bolele ka budget gore budget ya bone e bereka bjang le di plan tša bone for ngwaga o ohle le gore ke bokae e bereka eng for eng le eng le eng. Then lena after ba presentile lena le monyetla wa gore le botsise gore why go sena 1 2 3 or why kore go tswa go lena gore ge ba presenta e tlo ngwadiwa le mola le tla e bona gore le kgone gore mara e la o ka re kore go tswa go lena kere re tlisitse go lena gore lena e be lena le question a mo le mola kere re a kwana kere so kore ge le mola e no ba fa mahala lena le tshwanetse le botsise gore why akere why o ka re ya ho ha di clinic ya shota a ke so le nna mara ke no ra gore lena le iputisetseng gantši ge le tlile lena le tla le tse dingwe tse di sa tsamaelaneng ba bang not lena kaofela kere ba bang ba tlisa tse leng gore a ra tla ka tsona tse dingwe re tla di araba mara tse dingwe di karabo re a go di nyaka ko pele akere because a ra tlela tsona department e tla araba tse dingwe re tla bona ko pele. So ke tlo busetsa mic go DDG Baloi gore a kgone go continue ka presentation e re tlo e kreang enene lena le ngwaleng fatshe gore le tle le kgone go botsisa di questions akere. Ke nana gore ke a leka gore ke bolele ka polelo ya se Africa and then mang le mang o free go bolela ka yena a ikgonang akere re a kwana akere le bolela e lena le kgonang ska ra ituma maleme a go tlhokagale akere akere re ikreile tseleng a ra inyanya ko hae akere le feeling free go bolela language e lena le ratang re a kwana akere. DDG Baloi nako ke ya gago mme.
Thank you, Chair. Go tlo presenta Medoda wa Sutla Sotho mara mo tlo trying go tlhalosa hantle ka la ka puo o tla ba tlhalosa ka Xhosa. And then if ona la batlo re interpretate lang re tlo leboga. Over to you, Ms. Doda.
Thank you, DDG. Molweni, igama lam ngulindela Doda. I'll be taking you through the presentation. I'm not sure if it's showing on the screen. All right. So on the slide, I'm not going to give you all the details, but what the slide is showing is that The Gauteng province has the largest share of the population for South Africa. So in Gauteng, we've got about 16.1 million people, which represents 26% of the South African population. We're also telling you that the delivery for health is challenged because of what we would see on the news where the Minister of Finance cuts the budget. So the overall of that slide is telling you about that, even on the next one. I'll go to the budget. So on this slide, thank you. So on this slide, we are showing you that in the 2022-2023, the budget for the Department of Health has been cut by 21.5 billion. So I don't know, I'll go to the next slide, but that's what we are showing you. So these budget cuts, they have a negative impact on the filling of the position, the medicine availability, and any other resource or service that the department would like to provide. But we still try and provide what we ought to provide with the limited resources. So on this slide, we are showing you we've got about 8 programs within the department. So this slide is showing you what is the budget for each program. I think on the next slide, I will then tell you a little bit on what then the program do and what the focus is. So our budget, we had 61 billion in the 2022-23 financial year. So here we are showing how it's then split. So you will have the compensation of employees, which takes about 60% of the budget. We then have a budget for our goods and services, which takes about 32% of the budget. We also have transfers, and we also have a budget for capital assets, which amounts to 4.9% of the overall budget. So on the next slide, we are just talking to the issues of the allocation, the movement, and the decrease that we've had. But you will see that when we then go through each program in terms of what the budget is sitting at. So I'll also skip on this slide. It's just a breakdown and the detail of the numbers that you've seen on the previous slides. The budget assumptions, I will not bore you with that detail, because when you prepare a budget, there are some assumptions that you make in order to get to the number that you end up with as your final budget. That is done with the provincial treasury, which then also translates to the national treasury. So here, you'll remember there was a slide with the programs. We've got the program admin. Admin is sitting at a budget of about 1.4 billion. The main focus on the admin and the big chunk of that budget goes on to the ICT, which is where the department focuses on trying to modernize and have systems in place where we use more digital instead of the paper that we previously were using. And then we also have district health services. They have the biggest chunk of the budget because it's 4.6 billion. And that portion goes to the treatment and the prevention of HIV and AIDS, TB, and also some of the programs that are implemented by the department, like the program for the antiretroviral, the TB screening, and the HPV vaccine rollout, and the condom distribution. So those are some of the programs that the department undertakes, and the big budget is sitting there under the program 2. Program 3, it would be the emergency medical services, which is mostly our ambulances. So that budget goes on towards to buying and procuring the ambulances and making sure that we provide that service as the department. Program 4, which is provincial hospital services, it's got a smaller budget in the department, And the programs that are there is your maternal and neonatal accident and some of the emergency services. And I think now they're also including the mental health services under that program. Program 5 would be your central hospitals. It's slightly below your district health services, but those will be your central hospitals that do most of the hospital work within the Gauteng province. And the program is mainly funded through the grants, but I will not bore you with the grant details. And then we also have the health science and training. That one is more focusing on the nurses, the training of the nurses, and the colleges that the department provides. So the budget there is sitting at about 89 million. And then we have healthcare services. The budget is 412 million. The major portion goes to the laundry services, so that we can provide the laundry services and the clean laundry within our hospitals, and also the food supply services. Then the last program that we have would be the health facilities management, which is your infrastructure program that's responsible for your maintenance, for your building, clinics, and all of that. The budget that we had for the 2023 year was sitting at about 2.4 billion for the program, and the aim is to make sure we design, deliver, and maintain the facilities that the department has. That will be the end of the presentation, DDG. I don't know if there's something you would want to add. Thank you.
No, thank you, Chair. I don't have anything to add to the presentation.
Okay. Hello, DDG. I thought o ka bolela le ka di APP nyana gore batho ba understand gore o di APP ke efeng le improve service delivery kai wa bona budget yona mara ho ne di APP plans tsa lena for the year tse le nyakang go di achieve, so be ke re kganthe motlhomongwe o ka ba prefers chaba gore okay di APP mo re bereka so hanyane nyana because nako re sana le yona a re shoti too much ka nako go no re chaba sebe le idea ya gore le nyaka go dira eng for eng bang just go no thusa gore ba understand gore ge le re district health services, maybe go district health services go di clinicing le be le hopotse bjang kra gore lena le no e presenta like di figure di figures chaba se bone mara maybe tlhalosanyana ke le fa chance a re fele pelo ka gore ba tlogile gole ba nyaka information bolelang ganyane go no re le di target tsa lena ke le at least tse di tlo thusang gore setšhaba se kgone go ba le input le di honorable members ba ba lemo ba be le di input wa bona di plan tsa lena for the financial year e tlo ba eng and then ka ngwaga o re o thomileng o ke eng, what are the main areas that you want to target ka this budget akere go infrastructure motlhomongwe le nyoko aga kliniki or nyoko feleletsa kliniki something like that gore ba understand mo le appointang people with disabilities nyana or senior management mile before ke lebala. Let me also acknowledge the presence of the sign language officials in our meeting. We appreciate it very much, sir. Sorry that we didn't recognize you. And also those who made us to be connected. You always are supportive of our programming. le the leadership ya mola ho bontate Makwala ba ba re capturang ge re bolela ka mo ra le leboha le lena ba bohle you make our work gore ibe mmereko o sharp siabonga so DDG thusa gore o tle tlhaloseng di plan gore ke bolela sebaka so ke ra gore le a ti prepare ka mo gore le gone o tlhalosa mo ka gore presentation ya lena a se itse le 7 minutes ka gore ne le bolela ka di figure re di bone bo 20 million bo 4 million bo 4.9 million mara di tsamaelana le eng bana le yona information ba no ba le limited so ba limited nyana mara a go tshwenya ke re a lokisa le nyaka sa mo gore ke a le bolelela gore ke ba tlohela ya DDG ba re ke ska le tlohela le tlhalose mo so that ba tlohe mo ba le empowered gore no man ke bone ba re for administration ela ba ra gore mmola mo administration agere ka infrastructure ba bolela ka immola mo infrastructure le tlhalosenyana bo Mr Khobo ba hona ka ba tla tlhalosa gore at least mo go infrastructure go na le sepetlele se semtšha kapa go na le clinic e mtšha kae something like that a ke re nna a ke bereke le bona nna ke nyaka bona ba tlhalose le nna ke kgone go ba empowered a ke re so ba tshwanetse ba outline le di-plane tša bona in the area tše bona ba berekang ka tsona gore lena le kgone go understanda di-health facilities clinic ya moyo ke moyo ne moyo clinic e agilwe mara o ka re a iso bereke yeah something like that gore no ko moyo be re tlhopha ke motlhagatsi ba re motlhagatsi ke ona e leng bothata gore e tsene gore ba ko Etwatwa ba kgone go berekisa that clinic mara at least plan ya rena ko make sure gore within 3 months ke for example wa kere e tla be e bereka gore clinic e kgone go bereka e thuse setšhaba for example so ke ra gore ke le fa chance setšhaba se re se nyaka sa mmo a ke se poki mara ke re tla be go le unfair gore ke dumelane le lena gore no re ka 5 minutes mo public participation ape batho ba ka tla ba re ba se tle ka moso ba re bona ba e ka obane healthy e no ba shaya re shaya ne a ke re mo ya sharp DDG le official bolela msammo gore setšhaba se se tloge mo sena le idea gore oh okay ko Daveyton bile a go ne sepetlele plan ya bona ke eng go na le sepetlele mo batho ba Daveyton a ba go kama oh ba Etwatwa ba hona go na le sepetlele mo oh okay le covered mara moyo at least is a big clinic e berekaning for example so DDG over to you DDG.
Thank you, Chair. Ke a leboga. Maybe re na le what ntho e re bitsang gore ke strategic plan. So ke plan ya rona ya 5 years. And ka plan e ya 5 years, a ke re after 5 years ra vote. So re ba re tseba re na re plan ka Department of Health gore ka 5 years e re tla ba re etsa eng le eng. And then re na le plan e re bitsang gore ke annual performance plan. So for 5 years wa ke ra re ka se kgone go ira mereko wa 5 years ka 1 year. So re etsa plan e leng ka mo re tsa di plans tse dingwe tse di leng ka mo 5 years re di tsenye gore ka plan re tlhalosa gore re plan gore in that year for instance a ke re ngwaga rona re thomile ka April gore re tlo ira eng ke tlo thoma check some of the programs tse re na leng tsona re na le program ya dikolo a ke re la tseba gore gale ne re krea gore ba ba lekanang le nna ga ile ya ko sekolong nakong ne ba tla re o ka se tsene sekolo ka gore na le problem ya mahlo o ka se tsene sekolo ka gore ngwana a gone you know o na le problem ya ditsebe so re na le problem Chair ge re lebella ka ngwaga wa 2021-22 ka ngwaga o fetileng ne re budgetetse go ira program eo ya dikolo e na leng 74 ya bana for 74,000 for ngwaga o fetileng le ona ne re na le bana ba leng 3,350 so the programs tse di leng teng hangata le kra gore batho ba di tsebe re etsa di problems a ke re nako engwe ne go tlhola go tla manese ga ba fitla ba re tlhaba ba tsamaya ba ro ka se bile polo o ka se bile polio o ka se bile TB le eng kanti government now ina le di programs tse ngata tsa dikolo bana ba leng overweight you know nako ngwa ke re nako ngwana a le sedutla le re o ja haholo nako ngwe le kra gore ke malwetse re na le program eo e re etsang in partnership le Department of Education na re program ya mahlo re na le program ya go ba thusa you know with hearing re na le problem ya oral ke re ba bangwe le kra gore ga ba boa ba startaro kra re sani so aba thusi ba o fela ba thusa le bana ba ba sa goneng go bua mara also ba gona go ruta le bana ba bangwe gore ba ba accommodate so bana ba so that ba ska tlhola ba dula gae ba ra ba sa ya sekolong ka gore batho ba ba tshega go na le di program gape tsa TB tse re na le tsona le ba bangwe le kra ngwana o a le mosesane too much nako ngwe le kra gore ke malwetse mara a re wa bone nako ba re o tshwana le papa ha o tshwana le ramogolo wa gagwe le yena na le monyane nako ngwe kra gore kanti ke malwetse re sa wa boneng so ke program engwe e re na leng yona e re budgetetseng re tlo ira ka yona so re na le di program tse 8 so program ya pele ya e re na leng yona ke ya administration ke mo le krang gore ke administration ya gore program e supporta di programs tse dingwe so ge re lebeletse ka mo di program ene ke bua ka yona the way ne re plan ka teng ge le lebeletse ke gore bana number ya bona ya increase because a re sa tlhola re kgetha gore ya ko sekolong se feng re ya ko dikolong kaofela so ke one of the programs e re na leng yona eo mara program engwe ke batlang go bua ka yona ke ko program 1 re na le office ya finance ke bona ba supportang everyone ka ditaba tse di amaneng le finance bona ke bona ba ntshang le reng ke no e beya hantle ke bona ba making sure gore ge re na le di supplier or o tenderile o tlo patelwa and then ke bona ba making sure gore di services tse re na leng tsona di a patelwa ke bona ba making sure gore ge ba ko HR ba feditse go ira di plan tsa bona tsa go patala babereki ke bona ba patelang so plan engwe re na leng yona ka mo program 1 ya finance go patela batho within 30 days gore go deliver le di services tsa gago re gona gore business ya gago e gona tswela pele ro patele within 30 days ke yona ya program ya finance e re planning yona and then program engwe e re na leng yona ka mo finance ke taba ya gore ba dila gape le ka di assets gore re tseba gore ko re na le ditulo tse kae re na le ditafula tse kae ke bona ba making sure gore re tseba gore ditulo tse re na leng tsona di ko kae ene di berekisa ke bo mang so ke plan engwe e re ikemiseditseng go etsa ka mo program 1 re improve gape go patala batho ka nako program engwe ke ya corporate services ka corporate services re na le ke mo re na leng babereki ke mo re na leng communications ke mo go na leng batho ba trainang di doctor le di nurse go na le batho ba dilang ka molao and then ke ko yona program re kemiseditse gore re lebele structure sa rena ke re la bona gore ke gale ge me tota buile gore now number ya batho ba re ba bonang ba le di patients ke ba bangata So now re tshwantse re lebelle gape gore na batho ba re na leng bona ka mo health ki number e right and ba na le di skills tse right gore ba kgona gore ba be ba thusa batho ka portfolio ya rena. So re ikemiseditse gore this year re tlo lebella yona eo. Ya bobedi ke taba ya gore re make sure gore a re dule re na le tšhelete and re sa hiri batho. So re ikemiseditse go hira batho ka nako so that mmereko wa rona o kgona go irega ka nako. So ntho engwe e re buang ka yona ke taba ya gore a ke re ke buletse ka manese ba re ba trainang gore ba nese ba re ba trainang re ba fa di bazari re ba traine and then re make sure gore ge jara e fela or ba fetsa training ya bona ge re na le diposo re gona go ba appointa ka gore re tla ba re spendile tšhelete ngata ya go ba appoint ya go ba trainer. So ke yona eo ya manese. Engwe e re na leng yona ke taba ya di ambulance re make sure gore batho ba di ambulance tsa rona di tsamaya ka nako although re na le problem che ya gore nako engwe gore a ba tswe ka nako ka gore ge batho ba founela bosiu ba tshwantse pele ba founele maponisa gore ba tsamaya le bona ka gore go na le moyanyana wa go hijacka di ambulance mara re plan gore ra tseba gore re na le system e bontshang gore motho founile ka nako mang and ambulance ya rona e tswile ka nako mang. Batho ba di ambulance ntengwe re planning ke gore ba appointa le bona ba be le batho ba tlo ba thusang ba bangwe di ambulance tsa rona ge re ka lebella se a isa tshwana le truck. Di ambulance tse dingwe di na le metšhini e batlang gore batho ba teng ba e berekisang ba trainilwe. Program engwe e re na leng yona che ke program ya security. A ke re la tseba gore le security re na le problem gore batho ba tsena ka mole nako ngwe ba tsenya ba na le dithunya ba bangwe ba tsena ba na le ba fitla ka mole o le kry-a ba utswa dilo tsa batho. So security le yona ke problem e re na leng yona re plane gore re be re improve security ka all facilities not go protect babereke ba rena fela but go protect le di patient gore batho ba tsenang ka mole re be re tseba gore ke bo mang and ba tlo bona mang and ba tshwara dilo tse ba ka bulayang batho or ba gobatse batho. Program engwe e re na leng yona ke e ranang ke Ntate Khobo ya infrastructure ke yona e making sure gore di clinic tsa rona kaofela di infrastructure yona ya bereka so that batho ba kgona go ba le comfortable. Ntongwe ba irang ke maintenance ke bona ba making sure gore ge di toilet di sa bereke ke bona ba tsamayang ba lo di fixa ke bona ba making sure gore mo community ina leng batho ba ngata ke bona ba agang di clinic le dipetlele. Ntongwe ba irang ke go make sure gore di projects kaofela tse di na leng infrastructure di ko head office not di clinic fela ke bona ba re lokisetsang go batla go paintiwa or go batla go fixiwa metšhini kaofela e re berekang ka yone. So ntengwe e re buileng ka yona ke taba ya gore ge re lebeletse di programs tse ringwe tse le na leng tsona ke di programs tse le tholang gore batho ba di tsebe tsa go tshwana le tse di ranang ke bo mamope tsa HIV tsa di TB aba treat TB gape ba re ruta le gore re tsebe gore king se re tshwantseng re se etsa gore re sa tshwara ke TB and king se re tshwantseng re se etse ge re tshwere ke TB and ba gona gape le gore ba ye ko dikolong le gore bona ba sebetsa ka gore ba re gopotsa before re tshwara ke malwetse and then ba make sure gore ge malwetse ao a le gona ko dipetlele or ko di community go irwa eng ka tsona. So ke tsona di programs tse chair mo ke tlo fitlhang teng ka di programs tsona tse ntho engwe e leng teng ke gore in most instances re na le some days you know in the health calendar tse re di celebrateang and ke yona mmereko wa rona la gore go tshwana le today batho ba understand gore go ka tsamaya o le ko strateng o bolaye nurse o tseba gore batho ba ne ba tshwantse ba bone ke nurse eo by 50 you know now clinic eo e tlo ba le problem ntho engwe re etsang le bone ka ngwago ka the previous month ne re na le TB program and then gona no go na le malaria so le bona ke dilo tse ba di etsang gore ba be ba re gopotse gore tshwantse re be re etse eng ntho engwe e le etsang ke gore go na le program e trainang bo doctor le di nurse re traina bo doctor ba ga ba fetsa go traina ba tla gape ko dipetlele tsa rona le manese ba fitla ba ire community service and then hangata ge ba fetsa ba bangwe re ba rena le diposo tse re di beileng gore ga ba fetsa ba berekele mmuso mara ka nako engwe ka taba ya budget a re kgone go ba tseya bo botlhe so ke program engwe e leng teng e rana ke corporate services under HRD engwe ke ya gore batho ba be le wellness gore re make sure gore batho ba rona ba dula ba le because le di doctor le bona ba na le di problems le di nurse ba na le problems le nna ke na le di problems ke wellness gore e prepare batho or e thuse batho gore ba gona go dila le di issues tse ba na leng tsona so that mereko wa bona o tla ya ko pele problem engwe ke na leng yona e batho ba ngata ba na leng di problems le kra nako ngwe motho ya ko spetlele doctor a bona gore motho gantle gore o tshwerekeng or motho fitla a le in a situation ya gore a gona di doctor tse di enough ka nako e or nako ngwe a ba motshwara hantle or a ba nako ngwe ba kra gore ba ignorile go etsa tseli tsela so hangata le kra gore batho ba re suwa ge batho ba bona ba tlhokofetse so re na le unit e buelelang ka litigation ke bona ba dilang ka di cases tse di tshwanang le tseo so Chair, I think ke buile ka tse di critical in the departments tse di leng relevant go batho ba rena leng bona ke a leboga sorry Chair, I think the other one e ke lebetseng go bua ka yona ke quality assurance ke batho ba le ka complainang ko bona le butsise ka di clinic le butse gore ke mang motho wa quality assurance a ke re nako ngwe motho ana le complaint ge le ma comrade ba tla ba ngwaletse MEC ba ngwalela HOD ba no ngwalela everybody so gona le batho ba quality assurance ba dilang ka di complaint so unless if bao motho o ko clinic eo or le manager wa clinic e motho a tshwereng clinic eo a ba dili ka tsona di issue tseo then le ka gona gore le tlise ka mo central office so that ba gona go le thusa gore le tloira eng ge ona le complaint and then go dilwe ka yona re latelle marna ko ngwe ge le rumela MEC le kra gore now e tlotswa gape ko MEC e fite batho ba 8 kanti nkabe lile ko clinicing or ko hospital le botsa gore ke batla motho a dilang ka quality assurance ke batla go complain le complainile o tla le fa reference number and o tla le thusa go solve the problems tsa rona thank you Chair
re a leboga DDG yo ibile o boletse sebaka go feta presentation rena re tloetse presentation e ba long mara because re kopile gore at least o tlaleleditse go feta presentation and last year a ke rena re track a record be re na le di slide tse dintšintšintši maybe tse 70 ke sana le yona mo so ya today o ka re ne di le 5 re khopela gore le improving le ska tla ka tsela e ge re ya hape public participation le tle le information e otlhe ene e ngwadilweng e tlo bontshang mo la mo screening ka gore setšhaba sa Gauteng se nyaka go make sure gore le ngwadile mola dilo tse le reng le promisang setšhaba sa Gauteng. So re a leboga gore o tlaleleditse re mara next time re kgopela di tle di ngwadilwe di ska ba fela ka molomo so that re tshepe ka nnete gore dilo tse di ka mo nthong ya department mara re a leboga because o tlaleleditse rena re nyake go senyetsa setšhaba se sa rena and last time ba rile di kae ditokomane tse re yang ka tsona hae le be le hona ko sedibeng he ba re e kae hard copy so ge le tla next time le tle le tshwere di hard copy tse batho ba ba leng ka mo meeting unless if di ka mo di plasticing a ke sure mara he le ka tla le di hard copy ba ya go fa di feedback di community e ba fitla gore be ke ile ko multi-purpose center ya kae e kurulene tshepo then ba re so gore ba kgone go tracka gore ba bone gore ba rile ba tlo dira at least ba tla kae so re kgopela gore le ska re shaetša go ya pele ka gobane rena re tshepile lena ka gore rena re overseer lena so ke a leboga gore o tlaleleditse and then ge re ya ko pele a re berekeng mmogo at least o tlhalositse le gore ba berekelang department for example le nyaka ba patediwe within 30 days ge ba tlile go fixa something ko clinicing e seng after 3 years or after 2 years or after 6 months or after 3 months or so even within 30 days so that ba be le matla ke re go aga go lokisa tse dingwe go ya pele re a leboga o tlhalositse and then re file a message for next year re tlo e hana bile le ka se presente ge le 5 slides next year ge modimo a sa re beile re tlo hana re nyaka full presentation ke a leboga setšhaba re a leboga ka gobane ba presentile bile ba tlaleleditse ba bolela ba tlhalosa ke nako ya lena gore le kgone go di re ke kgopele ba portfolio ba ba leng mo maloko a portfolio go ya ka program ya rena gore le bona ba fahlele ka mkgo ba ka kgonang mo budgeting nna ke chaira meeting mara ke kgopela gore the honorable members ba be le seabe mo tabeng ke thobe ka bona and then ke tla go lena and then re kgone go tswela pele mo go lena honorable members go na le o a nyakang go bolela se sengwe mo budgeting e presentilweng today mo meeting wa rena ke tla re member Mfikwe ke number 1 ya bolele tela ke member Kanyana.
Thanks, Chair. Ridumedise Chavasa Etwatwa. Ridumedise the members of committee, the officials Taron. Just a few questions that I want to ask, Chair. On the district health system services. Presentation Ebuaka integrated school programs. So if we could be given a brief of what are those programs. And also the presentation says we're working in wards as well as in the community. If we could get a provision, at least be provided, Chair, to the committee on the wards that we're working at and what are the actual programs that have been implemented. Then on the emergency medical services, we generally have a problem, Deputy DG, with ambulances. What I'm asking is, I know there are SLAs or agency agreements that we have with the metros, the municipalities. So my question is, how far are we? I know that for the city of Johannesburg in particular, the province has taken over the running of ambulances, Chair, and that presents a problem in relation to turnaround times to the communities and when there are ambulance call-ups. So I would ask a question that says, which metros are we currently working with? Are the SLAs still intact? Because we had appointed metros as agencies for them to be able to provide the emergency services for us. What are the turnaround times that we have in relation to collapse of ambulances when communities are calling in at the call center, as well as how many ambulances are dedicated to our municipalities? My last question, Chair, talks about the health facility revitalization. The grant, what is the grant meant to do, and how is it benefiting health services in our communities? Thanks, Chair.
Taleboga Mhlomphegi Mfikwe, can Rikre Mhlomphegi Kanyani?
Lena ki tumedishe. Puchwa ka ke mabapi le infrastructure. Mara ke bea base mo population ba bolelang ka yona hore Gauteng population e ya godimo. Ene ba bolela ka gore shete re fihla bo ma 16 million. And a kere ke a lebella dipetlele tsa rena di a shorta. Yona ga ke tsebe gore na as the department go na le plan ya go oketsa dipetlele or le go putse jwang shetse mo budgeting le itsentshitse gore re kgone go meter population re na le yona 16 million. Now plan ya lena e mokae go oketsa dipetlele tse? A ke le a tseba bentse go bolela ka taba ya bo Captain Park Hospital ba re sa le tswalelwa, mara ke a tseba gore yeo shetse le tla kgole le yona go na le dikarabo godimo ga yona. Sela sa Carltonville sa le tswalelwa le sona, but re no ke no ra ona gore le budget ya lena le plan ne jwang go ka kgona go dira tabe ya dipetlele. Ke a leboga.
Re a leboga Morena Mhlomphegi Kanyani. Go fokotsa malwetse mo Gauteng, plan ya department ke eng? Go fokotsa malwetse, di diseases a kere di gona like ge ba eta ba boletse ka bana ba rena ko dipetlele ba ba nang le mmele. Now mo go ba re ke eng outreach le plan ya lena ke eng in terms of outreach ya lena go try go fokotsa malwetse ya ditshwekere? A kere bolwetse bo bongwe ba tshwekere ke lifestyle, gore re ja eng, re nwa eng, a re dire eng, ke type 2 diabetes. A kere mammope ela a se ya tlhago ya gore e notlile ke ka se re se jang rena. Re ja bohobe ra ithuru go sene merogonyana go sena di-fruits ya re tlela. Now department e planile go thusa setšhaba se sa Gauteng bjang gore e fokotse malwetse a tlisang ke ona a re a bitsang a lifestyle. Ke no fa example ka diabetes ka gore ke yona e re kry-ang ka baka la ra re sa ja dithotse, ba ba tsebang dithotse re sa di ja, ra di nyenyefatsa, re ja kota akere ene re ja kota le acha letsatsi lo lotlhe, re ja bogobe bo bontšhi. Dilo tseo a di re thusi ka selo ka gore di re tlisetsa yona e DDG a boletseng ka yona ya obesity na pile ra ba le malwetse ya ditshwekere. So ke tlo bušetša go lena go araba tše di botšišitše mara before a re boeleng ka mo go setšhaba le bona ba tlaleletse gore ge ba tlo araba tše re di botšišitšeng ba tla le lena e bane lena le dipotšišo. Ke tlo re ge le nyaka wa baneng dipotšišo ba emise matsogo ke le fa dinomoro, ene ge ke dingwadile mo sekebe go a tsena o mongwe le o mongwe ga emelela a re ke nna number 1 ka re go ne ba bangwe ba emisi matsogo. Mara he ke tlo re number 9 o kry go ne number 9 tse 3 a ke re ke phoso. A re emise matsogo ba ba nyakang go fatlhela mo presentationing ya rena. So ke tlo le fa mabitso nomoro ya hao go emelela gore nna ke nna original number 1 or original number 6. Gale ke bereka le ba bantši ke a tseba. Number 1 original. Wena 1 ya ke re ka mo. 2 yes 2 3 4 ke tla tla ka mo emampele ne emanyana mpele. Rile 4 a ke re 5 6 7 yeah 7 ekwa ka mo number yeah 7 ki kam 8 same row 8 yeah yes 9 akere ba fella ka 9 kam 10 okay ay man va per ka se 12 row akere per thoma mori ya so ar thomeng a fresh ar thomeng hape emisa matsogo le felelele kam number 1 number 2 number 3 number 4 number 5 yes 6 7 80 ki mo yes 9 8 10 sharp 11 ko morago ke na le 11 matsogo kam ene o molomong they know their numbers akere yeah so ki 11 original akere bao inamela ifufa baskar tsenele number 1 okay number 1 2 ma'am 3 4 5 6 7 8 sharp 8 refeleletse kam originals number 1 8 ke ka mo saeteng ye ka le no mo rantsa ile go pa 11 yo ba mo ba batla amo ke 8 ke ka mo ka right amo ke left a re tla go number 1
ke thome
go ka bolela godimonyana
ke a le tamisha maina rena ke bo JM Skukhune ke tswa ka re thabiseng ka promoter spray ke bolela gape
e biele go lenyana
ke re ke a le tamisha
e biele go le wena ya
le tamisha
okay
ke a le tamisha le mpotseng gape
ke motloela
le kae ya maina rena ke bo GM Skukhune from Rethabiseng promoter spray modula stulo ke nya go tishetša ke tloga ke dira ka borena ka ge le bolela le re ba le ba ka mo department eki ba dire shosho gore ge ba etla tšatši le leng ba bitša gote go be le dilo tše di swaregang di tšwang go bona mo godimo ga batho ba tlo kopana le bona ba re a ba tlo tloga ba ya magaeng ba tseba gore ba swere ntwe swaregang ba kgone go addressa setšhaba ba fe setšhaba information e tletšeng gape ya bobedi ke nyako tseba gore ge ba bolela ka dipatšete tše ba bolelang ka tšona di gona seo se ka dirang gore ditleliniki tše di sa leng tše nnyane ba ka kgona go di oketša na ene gape ya boraro ke nyako tseba batho ba le ba go tsena di door to door gante ke permanent mola gore ke contract na because if ile permanent le tlhaloshe le hono gore ke permanent ge ile contract banke ba tšwe go tsene ba bang le bona ba kgone thuša ba bangwe kgomo ya ga Skukhune a ntšhe boloko ka moka
2.
Hi everyone. My name is Gladys Holinyati. I'm from Western area. Kenako Simunye Extension 2. I'm one of the clinic committee members. We're not facing much problem, but ke mathata go dila le di patients in which the patients most of the time they don't understand when it comes to us explaining to them whenever ba thola line e le telle kapa line e sa tsamaye inside the facility or the clinic, it's not because of the nurse they breaker or aba batle go sebetsa. Those people are working and they are working under pressure. So all we have to do ke go ba explainela gore no guys re kopa le beng patient ba tlo le thusa, and the nurses tsa rona tse sebetsang today ha di enough. So we asking the government again gore e ka re ba ka etsa ka bonako gore ba hire di nurse go tlo ba le di nurse tse enough inside the facility so that the patient tsa rona di khona go di ska dula nako e telle ko di clinicing, because they complaining ka gore ha e sa le ke tlile ka 7 go seng ke tlo tsamaya mo a clinic e kwalwa. So all we ask from the government ke gore go iriwe di nurse tse more le di sisters di be more so that khone go balance taba ya nako. And again di clinic tsa rona di nyane o tla kra gore yanong a re khone gore di patient tsa rona di ka kena kaofela inside the facility o tlo kra ba bang ba dutsi montle, and yanong go a tshisa motho a kula o ka kra mong letsatsi la motlhola. So I don't know whether the government ka re thusa gore e ba agele meritinyana gore at least antse ba emetse go ba kene ka mogare ga di facilities tsa rona tse nyane ba kgone gore at least ba nne accommodated ka montle ka mole ba sa fila ekete aba khathaliwe. We do care if re ne re sa khathali Department of Health is a le khathali or tsone di nurse or bone batho ba tshwereng di clinicing ka be ba sa re hira us as clinic committees gore re beteng re tlo khona go le assista re le tlhalosetse whenever le na le mathata. And le di complaints tsa lona, not to say ha le kentse di complaints inside those complaint box, we don't go through them. We open the box, we go through your complaints, we find a way of solving the problems tsa lona. Not to say he khangata khole kutla ba re la di tsa le di latlhela ko di thuteng ko di dumping. No, a go yalo ga di bula ga di bala. Our sister in charge e dula le gona ko fatse ga bona go di problem tsa lona ge di solve yang. Not to say a khathale ga le khathalla. And le nna azanka re no, I'm just going there for fun. No, ke le ka re ke volunteera ke batla go explain di patient tsa rona di itse gore we the clinic committees re emetse community, re emetse bakudi ba rona, re emetse each and everyone o tlhokang thuso regarding healthy and whatever fela tlileng ka yone. Thank you.
Mr. Kobo, community e complaina ka o tlhoka shelter ge ba emetse go tsena ka clinic mo le tshwanetse le be le plan le rena gale re raiser gore ba ema letšatšing mare ha a etla ene ke monyama a ba safe because ba tla frugu go needega plan ya gore ge ba le ka mola ba be in a safe place ba emetse go tsena ka clinic eo yona e tobile wena gore what do you do? Most clinics space ke se senyane a gone shelter le madulo, and the clinic will not function if there are no people coming. So it means people, they want the clinic to help them. That's why they come even when go tonya, even when it's raining. The umbrella di queuele outside the clinic because ibula ka nako e itseng. Thank you. A re ko number 3.
Dumelang. Naka na lebitso la ka ke nna Lerato Molete ke tswa ko Ward 119 ko Slovo Park. From the budget ene e raisitswe mo this training aka utlwa le caterer for batho ba di disability. And then mo tabeng ya youth employment empowerment the skills ala bua ka tsona, but besides from training the nurses studying already more le di doctors. And then the system ya o dila le di nurses studying route
ile ya raise-wa kwa ko Sedibeng party I also change next ke system e feng e sebediswang ho deala le behavior e jwalo and then mo tabeng ya infrastructure ne ke kopa it's just a plea hore le thuse batho ba di disability because ba bang ne ha bana yona tjhelete ya patala di private doctors hore ba ba thuse ka di exercising and stuff like that and then ne ke rata mo one of the programs tsa lona tse le tlo di implementang or tse di leng already on the way ale ka kenya di programs maybe tsa bo teenage pregnancies di atraswe ko dikolong and then kutlule mem o bua ka taba tsa una le awareness ya malaria and stuff rona re le so a re kulu every day and then we won't be able to reach clinic for that kind of information how about o be le batho ba ba tsamayang ba thole incentive nyana and then ba rute di communities ka yona this awareness thank you so much
Thank you. Number 4.
Thokozani. Kena Maleshwani Sipula. I'm from Forgeville. Na ke kopa ho botsa mo ya di school programs. Utlile me basani ba lo e abua ka di eye programs, the ear and oral. So now ke kopa ho botsa hore is it already in practice or is it still on the process ya hore e tlo ya ko dikolong? Because now personally I've been signing the forms tsa hore ba ngwana tlholuwe bo matlho ko sekolong ba di romela akere to get permission from motswadi but it doesn't happen. And then my second question goes to wellness. Akere ho thwe is to help people deal with their daily problems but kutle me basani abua ka di nurses, doctors etc. Na ke kopa ho botsa hore community yona because now you can go to the clinic o fihle mo ha o fihla you would book for counseling. Mama ka ke kopa ho bolela especially ko thusanang ke tswa Forgeville. Ke kopa ho bolela 5 years e ka feta. O sampane o emetse counseling. So now ne ke kopa hore le mo ke tlhalosetse hore at least go tlo diliwa yang ka ditaba because last time I checked rena le di social workers mo di clinicing rena le batho ba beetsweng hore ba ka re thusa ka dio tse yalo but then ka hone ha iyo thuso eo le di suicide di anyoloha because people don't get help yona ne ke ipotso tsa ka tseo ke a leboha.
Thank you. Number 5.
Avil.
Covered. Number 5 is covered.
Number 6.
Dumelang bagolo. Nna ke o ke tswa ko Kagiso. Bathong health. Bonkgono ba rona ba mixa le di passengers ba ema ko renkeng. Ba fola line e qala kwa e tswe ilore ko renkeng. Di taxi ba thunyana anytime. Ha go ka etsagala gore go thunyaniwe go etsagalang ka bankgono ba ba emeng mo lineng ba bang ha ba itsutsa ma ba bang ba tsamaya ka dithobane pula yana go a tshesa go a tshwana a gona difference. Please re kopa le implementing whatever e buang le yetsa because this thing batho ba sola ko di gating tsa ko clinicing go sna nurse e leng gore ya attenda or go etsagalang. Le tsone di complain tse re di kenyang ra di kenya yes di complain but ha di attendiwe o ilo e botsa mang ha o ya o re ke leile complain o e leile neng ko mang o ka se re ke leile maobane but then ke kentse mo boxong a ke itse ba e bulaneng a ke itse ba e balaneng a ke itse ba e latlhela kae. So please bonkgono ba rona go na le bana ba bo matere days mo di lineng go na le bana ba bannyane go na le bo epilepsy mo teng mo go busy di taxi ka mo le tsone di busy everybody busy ke rush hour. Please re ko sona po gona go wes ke clinic ke renke line e a tswa ke ele e ya ko renkeng. So please ha le batla di voutura le voutela la tsena le etsang ha go tshwantse go implementiwe dololo. Please.
Number 7.
7. Thank you. Sanibonani. Umam Ngomezulu lokhulumayo. Ngihlala la Etwatwa West, Ward 67. Clinic yam Joy Clinic. Before ngikhuluma, who is in charge ku transport? Before ngikhuluma, ngicela in charge ku transport iqala.
Ora transport ya ambulance.
No, wait for me first.
Oh,
Yime ngikhulumayo ene yime eng-disable. Nothing about us without us. Ngicela ume kancane. Njoba ngibuza umuntu transport.
Mamkomezulu.
Yes ma.
Ubutisa rena or ubutisa mang?
Ngicela ukwazi icala ukuthi uphi umuntu organize ama transport icala.
That is why I'm asking hore unyaka hore na ko ambulancing or lena heli tlakam.
Hari tlakam.
Oh.
Ngicela isisutha ngisazi ngumZulu.
Hayi wena khuluma mina ngiyakuzwa.
All right.
Mara.
All right. Masiza kanye ngapha ne mama. Sibuya le phansi West enesikuphuka ibridge enengihamba nabantu abangaboni ne and nami ngokwami I'm disabled but mangibheka la ngaphandle ama transport there's so many bengicela ukucela nje ukuthi if ever sesibuyela emuva kube nento esithathayo isibeke ngiyacela lapho isicelo.
Okay, wena you must uze ngizoza kuwe si arrange leyo yakho.
Ngiyabonga sithando sami. Thank you my dad. Sengiyaqala ke ngiyakhuluma ke. Yes. Njoba ngikhuluma ke okokuqala ngifuna ukwazi ukuthi akhona ama ambulance la ngaphandle na. Akhona ama ambulance angithi awekho ama ambulance. Njoba ngekho ama ambulance la kunabantu abagulayo kunabantu abanama epilepsy kunani if ever umunye umuntu uyaquleka la iphi paramedic la ezomsiza and kunomama engimzwile akhuluma ngama ambulance lapho ngicela ukukuphikisa sithando sami ama ambulance awayenzi next nothing yangiva mama last week Monday kunomama benginaye agula ngifonela ama ambulance kwaze kwaba 5 times azange ize ne1 size saqasha imoto yamuse Far East makafike Far East wathola ukuthi sekayashona inkinga yabo bani ama ambulance lanko wabeka phambili ngawabeka phambili ama ambulance clinic ne akhona ama clinic sawabona kodwa sivuka ekseni siyokufola lapha masiqeda ukufola lapha yana masingena bazothatha amakhathi wethu but still we are going to wait simele ama-file and mawuqeda uthuthi baba wamemezela elakho ifile alikho mawubuza lilahlekile ama-file alahleka kanjani kanti ahlala endaweni eyi-1 nathi siyile esikoleni singawuthola itohonyana lapha sisebenza ukuseva lama-file lanka ukuthi abe right and kunento esiphatha kabi thina singama disabled futhi especially mina engihamba nabantu abangaboni ema-clinic abanama right ukuthi if ever umuntu o disabled owumama a pregnant bambuza ukuthi kanti wena umitha kanjani ungaboni kusho ukuthi yena akanamizwa na akanawo ama feelings yena kumele angabi nomuntu owesilisa eduzane ngoba akaboni amanesi afundela ukuthi kumele ukuthi ayenze izinto eziright kithi kodwa abazenza izinto eziright kithi okumanje ama chronic bathe bazawa deliver ezindlini abasadeliver ba relax kumele ukuthi ama medication abo mawaphelile kusukume thina nanko wami ubaba kaboni mara yime kumele ngisukume ngihambe ngeclinic ngomlandela imedication but they call themselves amanesi umsebenzi amanesi kahle yini ngiyacela ke ngoba sengikhulumile ngiyethemba ukuthi ngizwakele please do something especially for ama disabled nama old age ngoba ngibona ngathi wona valeleka ngaphandle isikhathini esiningi ngiyabonga
Okay. Man, ase mmereko wa manese go deliver ditlhare. DDG o tla araba hore ke bo mang ba ba leng responsible go distributa ditlhare le go di isa go community. So manese tshwanetse ba bereke ka clinicing, mara department must know hore ke di bo mang ba di driver ba 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 appointileng go isa ditlhare go mahaeng. So go lokile Mam Komezulu ba tla araba mara ya di nurse yona ke nyaka go protecta di nurse gore for distribution ya ditlhare no bona as ke non nursing duty serious that one. Number 8
Okay. Dumelang. Nna ke nna Peter Manamela. Ke dula mo Etwatwa. Ne go kgopela gagolo mo dipetlele. Ke buella gagolo bona batho ba ba sa boneng. Mabapi le nna gagolo. Ne ke tsamaya go St. John. Ke feleditse ke sa tlhole ke kgona ka taba ya budget. Ka gore ne ke na le motho ne ke tsamaya le ena. Ne ke feletsa ke mmaka gagolo, ya mmaka ile a tlhokofala. Ba latela ngwana ka le ena ngwana ka o tlhokofetse. Ke na le ngwana e one. Mosadi aka na le matshoreng teng le tona. Yana ke na le bothata gagolo ha ke kgopela motho ha mpheletsa ba na le go fela pele. Yana na ke batlo tseba gore na thuso nka e krea from ditlhare tsene ke di tshela from kwa ko St. John. Di ka kgona go tla mo PBH na. Or ba re zamele di ambulance. Yana ka gele bolela ka go ka ambulance. Ga go le gore rena batho ba sa bone re na le mmereko montsi. Ka re go kgopela motho fela gore a o felehetse. Wa tinela. Ha ntshwara ka letsogo ga nkisa ko St. John. Motho le ha boa ha sa ipatla. Umpatla tšhelete. Ke bua bjana a ke sa ya ke ke tshwere 2 years or 3 years. Bjano se re no dula ka gore a se re dutse ka go rata ke tšhelete. Pelo ya ke ba botlhoko ka re thuso ne ke e kry-a gona moo. Ka re kile ka thoma from PBH ba tlholega but kile a re mmaka sa phela a re ro leka ka ya go Dr. Mahlasi and transfer la gore ke ye ko St. John maybe ke tla kry-a thuso and kile ka e kry-a thuso ko St. John. Ko St. John ke kry-ile thuso matlho a ka a leka. Mara ka no ya no ka gore ke maka ke budget a ke sana next a ke sa kgona go na go ka kgonagala bjang gore ke nka kry-a ditlhare ka mo PBH or le re batlele transport e ka re isang ko St. John. Bjana ka ge di ambulance di lata batho ba ba kula ga go rena ba sa boneng ke tshwantse re be le ona ambulance ya rena e tla re tseyang e re ise moo ka re ra give up gona bjano ganti thuso ne re kry-ile matlho a rena ne a tla bona ka bane ke matlho ke a sa bona ka eng a re sana thuso re a defaulta gona bjano ene o boletse doctor gore ge ke sa tlhole ke tla matlho a wa yo feletsa a sa bone pele ene ke yona ke e bonang gore ke tle ke eme bjana ke emisa ke yona lebaka leo a thoma a nyaka go ba blind gagolo ka taba ya ona tsheo a mantši a ke na ona.
Thank you. Number 9, original number 9. Yeah. Go ahead.
Molweni, igama nguNozuko Lusiki from Tsakane, Ward 99. Okokuqala ngizokhuluma ngendaba ye-ambulance. I-ambulance kahle kahle is a challenge. It's not like ngivile ukuthi ukhuluma ngendaba yokuthi i-ambulance zine problem ebusuku because ziya hijackwa. Same applies nomuntu ozoyidirector ebusuku ngo-1.